Okay, so hello and welcome to iTenif Healthcare Solutions webinar. Today we're going to be presenting on HIPAA Audits Phase 2. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for iTenif. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. Next, for those of you who aren't familiar with iTenif, I wanted to share a bit of who we are with you. We've been in business as iTenif since 2003, but have been NextGen users since 1997, EPM version 2.3. We specialize specifically in NextGen healthcare. Our development teams know how to get data into, out of, and around NextGen to customize it and tailor it to meet our clients' unique needs. Our purpose in life is to create delighted clients by helping them get the absolute most out of their NextGen software investment. It is our passion to provide solutions for our NextGen provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. We really do everything NextGen, from consulting to hosting, to customization to support, and we have two NextGen add-on productivity solutions, ChartGuard and Refund Manager. Next, I wanted to bring your attention to our upcoming webinar. We're looking forward to the third and final webinar in our three-part webinar series, Improving Federal Security Initiatives, The True Impact. It's going to be on July 27th, and we'll be covering MARCA, breaking down the proposed rule. Our objective with that webinar is to leave you with an understanding of the changes put forth by MARCA and what to expect, how to prepare for these changes in 2007. Keep your eyes out for an email on that or sign up on our website now. Okay, so going back to HIPAA audits, at the end of the presentation, we're going to open up the floor to questions from you. We will answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. For your reference, we're also going to be emailing out links to the recordings and PDF of the presentation later this week, as we do with every webinar. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. So without further delay, I'd like to introduce our presenters for today, Lindsay Lanning, Cindy Kincaid, and Kathy Thompson. Lindsay Lanning originally joined us from the Ohio State University intern program, where she was getting her degree in Health Information Management Systems. After graduation, Lindsay joined our team as the Healthcare Informatics Coordinator, where she spends her time immersing herself in the ever-changing healthcare IT environment and educating the rest of the company on new issues and trends in the industry. Cindy Kincaid is Vice President of Consulting Services at iTenif and a Certified Practice Management Executive. With over 25 years in the IT healthcare industry and over 9 with iTenif, her experience runs wide and deep. This makes it possible for her to provide the insights needed to help healthcare organizations experience great success, no matter what the challenge is. Kathy Thompson will also be available to assist with questions at the end. Kathy has been with iTenif for over 10 years. Prior to joining iTenif, she was a medical assistant at a neurosurgical practice. This is where she got her first taste of NextGen and has been hooked on it ever since. Currently, she is a managing consultant at iTenif, where she specializes in NextGen EHR and incentive programs, which makes her an excellent resource to assist with your questions at the end. Okay, so Lindsay, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Great, thank you, Chelsea. Hi, everyone, and thank you for joining us today for our webinar, HIPAA Audits, What Phase 2 Means for You. Phase 2 HIPAA audits have arrived, and with these new audits comes a new audit protocol released by the Office for Civil Rights this past April. Covered entities and their business associates are now being targeted for an OCR HIPAA audit and are being given a very short amount of time to supply the documentation requested. With that being said, we think it's important our clients and all healthcare industry stakeholders are familiar with the new audit protocol and what to expect if your organization is selected for an audit. But before we even get into the main content of the presentation, there is an important update everyone should be aware of. We know the Office for Civil Rights, or OCR, is the enforcement agency for HIPAA, and that Phase 2 of OCR's HIPAA audit program has officially begun. However, what you may not know is that OCR has sent selected covered entities notification letters regarding their inclusion in the desk audit portion of the audit program. The desk audits will examine the selected entities' compliance with the HIPAA privacy, security, and breach notification rules. Email notification letters were delivered on Monday, July 11, 2016, to 167 health plans, healthcare providers, and healthcare clearinghouses. Covered entities should monitor their spam filtering and junk mail folders for emails from OSOCRaudit@hhs.gov. Entities only have 10 business days, so until July 22nd, and that's this Friday, to respond to the document request. Desk audits of business associates will follow this fall. So if we get back to today's webinar specifically, we will start with a brief review of HIPAA and then move on to the audit process. So from start to finish, what a covered entity or business associate can expect, as well as the new audit protocol that was just released by OCR this year. And we will wrap things up by going over the elements to an effective compliance program, looking at best practices for passing a HIPAA audit and key features of a strong compliance program. So I like doing these slides that feature recent headlines because it really shows the latest news the healthcare industry is concerned with on the topic. And with HIPAA audits, we can see there's a lot of things mentioned here. There's the new audit protocol, increased funding, a greater focus on business associates, and how HIPAA will be affected by MACRA. And these really are all the latest trends and changes we're seeing today. Now, if the headline's going to grab your attention, this just might. Jocelyn Samuels, and that's the director of the OCR, was quoted earlier this year saying, while the first years of HIPAA were about education, the years ahead are going to firmly stress enforcement. And this couldn't be more true. Settlements in 2016 have already totaled more than any other year at $8,664,800. And consequences include high fines, prison sentences, and medical license being revoked. If you take a look at this graphic, it shows what types of covered entities had the largest settlements as of May 2016. And you can see, number one, these are really large amounts of money. And number two, everyone's different. There's a broad range of organizations represented on this chart, from insurance companies to pharmacies, business associates, even a dentist. These enforcement efforts, especially audits, are targeting a wide variety of entities and are only getting stronger. So what is causing this increased enforcement? Well, first off are the large breaches the healthcare industry has been seeing. Anthem being one of the biggest, with 80 million Americans' information compromised. This was a wake-up call for the OCR. They're in charge of enforcing the privacy and security of this type of information, and they realized something had to change. Then in that same year, Jocelyn Samuel started as the new director of the OCR. And we can see that quote I mentioned on the last slide here, demonstrating her commitment to and focus on enforcement. And finally, Phase 2 audits began. And with that came a new audit protocol, an expanded pool of auditees to include business associates, and program overlap with meaningful use and other similar programs. However, one of, if not the biggest, contributing factor to this increased enforcement is the increase in the 2017 fiscal budget to $43 million for the OCR. With the new budget, HHS will be able to pursue its initiatives more efficiently and prioritize HIPAA compliance audits. The budget increase also allows OCR to increase its team of on-staff auditors in preparation for the next round of HIPAA compliance audits. Without the proper funding, more audits would not be possible. But with this increased financial backing, we know they aren't kidding around anymore. Now, as we start to see the frequency of HIPAA audits increase, it's important we are aware of the different rules that make up HIPAA. If we look at a quick regulation overview and how they all relate, we can get a better idea of where all of these pieces and parts fit together. So we have HIPAA, whose goal is to protect PHI while increasing patient access and control over information. And then we have the Omnibus Rule. And the Omnibus Rule really had an impact on HIPAA because it required business associates, or BAs, to be HIPAA compliant. And basically, they're now responsible to create business associate agreements in order to protect PHI as well. And lastly, high tech and meaningful use. They both have impacted HIPAA by increasing the adoption of EHRs and therefore increasing the amount of ePHI data. Looking at the big picture, we can see all of these regulations work together and overlap in specific areas in an attempt to keep your health information secure. So in order to fully understand how to successfully pass a HIPAA audit, we need a brief recap on what HIPAA does. First off, HIPAA has three parts. The privacy rule, which describes what information is protected and how protected information can be used and disclosed. The security rule, which describes what safeguards must be in place to ensure appropriate protection of electronic protected health information, and the breach notification rule, which governs what to do if PHI is breached. And then who has to comply with HIPAA? First is covered entities, which are healthcare providers, health plans, and healthcare clearinghouses, and then of course business associates. If we take a closer look at the security rule, it's in place to ensure the confidentiality, integrity, and availability of all electronic protected health information, or EPHI, that a covered entity, or CE, or business associate, BA, creates, maintains, or transmits. The security rule lays out 3 sets of safeguards: administrative, technical, and physical. And then if we switch gears to the privacy rule, what does that specific part of HIPAA do? Well, it gives patients more control over their health information. That includes its uses, disclosure, content, and access. There are 2 pods of the HIPAA privacy rule: access and patient rights. This rule gives patients greater access to their health record while limiting it for others. And it also increases patient rights, giving them more control over their own information. Now let's look at the difference between privacy and security. The HIPAA privacy rule describes what information is protected and how protected information can be used and disclosed, versus the HIPAA security rule, which describes what safeguards must be in place to ensure appropriate protection of electronic protected health information. Notice I highlighted electronic. I did this because the privacy rule applies to PHI in all mediums, and the security rule is strictly for electronic PHI. The privacy rule really answers the questions what PHI is and how it can be used, whereas the security rule answers the question, how must I protect ePHI? Okay, so we are ready to look at the audit process from start to finish and get an idea of what to expect if you are selected. First off, let's look at the program objective. The audit program is an important part of OCR's overall health information, privacy, security, and breach notification compliance activities. OCR uses the audit program to assess the HIPAA compliance efforts of a range of entities covered by HIPAA regulations. The audits present an opportunity to examine mechanisms for compliance, identify best practices, discover risks and vulnerabilities that may not have come to light through OCR's ongoing complaint investigations and compliance reviews, and enable OCR to get out in front of problems before they result in breaches. OCR will broadly identify best practices collected through the audit process and will provide guidance targeted to identified compliance challenges. So the Office for Civil Rights is conducting audits to make sure providers are HIPAA compliant and PHI is safe. This initiative was broken down into 2 phases. Phase 1 audits took place in 2011 through 2012, while Phase 2 audits are taking place right now. So these Phase 2 audits that are going on right now focus on covered entities and their business associates, non-compliant standards discovered during Phase 1, risk analysis and risk management, security standards, encryption and decryption requirements, facility access control, and breach notification. These are just some of the main topics we've seen OCR focusing on. Obviously, the audits can cover many more areas of compliance, but these are the ones to pay close attention to. Now, before we dive into the audit process, there's some key things to point out first. OCR has issued and finalized a new audit protocol for Phase 2 OCR audits. Phase 2 will include covered entities and business associates. Phase 2 of OCR's HIPAA audit program is currently underway. Selected covered entities received notification letters on Monday, July 11th, and business associate audits will commence in the fall. OCR has contracted with FCI Federal to conduct the audits in conjunction with OCR staff. These audits will proceed throughout 2016 and beyond. And a pool of potential audit targets will be identified. And out of this pool, several hundred will be selected for audits. Who is included in this pool of potential audit targets? Well, every covered entity and business associate is eligible for an audit. These include covered individual and organizational providers of health services, health plans of all sizes and functions, healthcare clearinghouses, and a range of business associates of these entities. Now, if you're wondering what are the chances you will get selected for an audit, take a look at this graphic, which shows the distribution of CEs and BAs that will be selected, as well as what area they will be audited in. So 150 covered entities and 50 business associates will be audited on the security standards. The privacy standards will have 100 covered entities audited based on its criteria. And finally, the breach notification standards will also result in 100 covered entities being audited. This means there will be about 400 audits in total taking place as a part of this Phase 2 initiative. So how will auditees be selected? For this phase of the audit program, OCR is identifying pools of covered entities and business associates that represent a wide range of healthcare providers, health plans, healthcare clearinghouses, and business associates. By looking at a broad spectrum of audit candidates, OCR can better assess HIPAA compliance across the industry, factoring in size, types, and operations of potential auditees. Sampling criteria for auditee selection will include size of the entity, affiliation with other healthcare organizations, the type of entity and its relationships to individuals, whether an organization is public or private, geographic factors, and present enforcement activity with OCR. So that basically means OCR will not audit entities with an open complaint investigation or that are currently undergoing a compliance review. In most cases, healthcare providers are selected through an NPI database and clearinghouses and health plans from external databases. OCR really is looking for a wide range of entities to audit. I mean, anything from group health plans, physician and group practices, behavioral health, dental, hospitals, etc. I mean, really no one is safe from these audits any longer. The OCR plans to complete 3 phases of audits throughout 2016. The first phase will involve desk audits of covered entities, and the second will be of business associates. These evaluations will examine the organization's compliance with HIPAA's privacy, security, and breach notification rules. And then the third set of audits will be on-site and will examine a broader scope of requirements from the HIPAA rules than desk audits. However, some desk auditees may be subject to a subsequent on-site audit. So we are currently in the first phases of audits, which are the desk audits. And desk audits are a remote audit requiring the upload of documents to a secure portal created for this purpose. For desk audits, the OCR will request a number of documents that must be delivered within, again, 10 business days, and may require the organization provide documentation up to 6 years prior to the audit. Requested items can include records of security reviews, remediation plans, policies, procedures, employee training logs, really any information that correlates with HIPAA compliance standards. And all desk audits in this phase will be completed by the end of December 2016. So these desk audits are focused examinations of documentation of entity compliance with certain requirements of the HIPAA rules. Specific requirements are as follows. Under the privacy rule, OCR is looking at notice of privacy practices and content requirements, provision of notice, specifically electronic notice, and right to access. With the breach notification rule, they're looking at timeliness of notification and content of notification. And under the security rule, OCR is really looking at the security management process, specifically risk analysis and risk management. So we know how entities are selected and what the focus of the audits are, but let's look at the process from start to finish. First, address verification. An email is sent out to confirm contact information. Once entity contact information is obtained, a pre-screening questionnaire designed to gather data about the size, type, and operations of potential auditees will be sent to covered entities and business associates. This data will be used with other information to develop the pools of potential auditees for the purpose of making audit subject selections. OCR will then be asking covered entities to identify their business associates. OCR will choose auditees through random sampling of the audit pool. Entities selected for an audit will be sent an email notification of their selection and will be asked to provide documents and other data in response to a document request letter. Audited entities will submit documents online via that secure audit portal on OCR's website. There will be fewer in-person visits during the Phase 2 audits than in Phase 1, but auditees should be prepared for a site visit when OCR deems it appropriate. Auditors will review documentation and then develop and share draft findings with the entity. They then will have the opportunity to respond to these draft findings, and their written responses will be included in the final audit report. The final audit reports are prepared, generally describe how the audit was conducted, discuss any findings, and contain the entity's responses to the draft findings. And if anyone is thinking they can outsmart the system by just not responding to the address verification email, OCR has stated if a covered entity or business associate fails to respond to information requests, they will just use publicly available information about the entity to create its audit pool. They further specified that an entity who does not respond to OCR may still be selected for an audit or subject to a compliance review. So don't think you can get out of it just by avoiding them. Similarly, if we look at the process for on-site audits, entities will be notified via email of their selection for an on-site audit. The auditors will schedule an entrance conference and provide more information about the on-site audit process and expectations for the audit. Each on-site audit will be conducted over 3 to 5 days, depending on the size of the entity. On-site audits will be more comprehensive than desk audits and cover a wider range of requirements from the HIPAA rules. Like the desk audit, entities will have 10 business days to review the draft findings and provide written comments to the auditor. The auditor will complete a final audit report for each entity within 30 business days after the auditee's response. OCR will then share a copy of the final report with the entity. So if we walk through a desk audit together, the first thing was address verification. OCR conducted address verification this spring to confirm contact information and to identify covered entities and business associates of various types and determine which are appropriate to be included in the potential auditee pools. Communications from OCR will be sent via email and may be incorrectly classified as spam. So if your entity's spam filtering and virus protection are automatically enabled, OCR does expect you to check your junk or spam email folder for emails from them. And then here on your screen is just a sample of an address verification email that was provided by HHS on their website. Next is the pre-screening questionnaire. Questions address size, location, services, and best contacts. OCR will use the results of the survey to select covered entities to audit. So the questionnaire is made up of 4 parts: instructions, contact or entity info, questions, and review and submit. First is instructions, and that just says something generic like if you're unable to complete the questionnaire in one sitting, you can save your responses and complete it at a later time. Then you have the contact and entity type information, and then the questionnaire portion. And then you have the review and submit. And at this point in the process, the system will display all the questions with your responses. So from this page, not only can you go back and edit a response, but I'd highly recommend you print the page for your records, and then you can also submit. But once you submit it, the access to the questionnaire is no longer available. The entire questionnaire is available on the hhs.gov website under the HIPAA tab, but at a quick glance, there are 5 sections of questions found in the questionnaire. The first is basic description information about your organization. The second is healthcare providers, then healthcare clearinghouse, house plans, and business associates, which is a screenshot you see on the screen. Note that a response is required for all questions, no matter what type of entity you identify as. After address verification and the pre-screening survey, auditees will be chosen and notified of selection. If you are selected, you will receive 2 emails. One email includes a notification letter, which will introduce the audit team, explain the audit process, and discuss OCR's expectations in more detail. It will also provide instructions for responding to the desk audit document request, the timeline for response, and the unique link for each organization to submit documents via OCR's secure online portal. A second email contains an additional request to provide a listing of the entity's business associates. Again, email notification letters were delivered on Monday, July 11th, and entities only have 10 business days, so until this Friday, to respond to the document request. Organizations really cannot afford to let a notification slip through the cracks, so please, everyone, check your email. As I said, selected auditees will be requested by OCR to identify and provide detailed information regarding their business associates. The information collected by OCR will be used to help identify business associate Phase 2 audits. Covered entities should provide the requested information to the best of their knowledge and include the name and types of services provided by each business associate. OCR has developed a template which covered entities may find helpful to use when responding to the business associate list request. So CEs may, but are not required, to use the template which is shown on the screen. It is downloadable from the HHS website if a CE would like to take advantage of this method, and it is recommended by HHS you do so. This new template is meant to be a resource for potential auditees so that they can proactively engage with OCR as they begin to conduct their audits. It has spaces for all the information OCR may request, such as business associate name, type of services provided, first point of contact, title, name, address, phone, fax, email, the same information for a second point of contact, and their website URL. OCR suggests the potential auditees use this new template to track their BAs so that they can quickly and easily respond should OCR request the information from them. So at this point, we were selected for an audit. We received our email, we sent back all of our BA information, and we uploaded the requested documentation within 10 days. OCR will come back with their findings in what's called an audit report. The final audit report will contain the stages of the audit conducted, the findings of the audit, and entity responses to draft findings. Audits are primarily a compliance improvement activity. Generally, OCR will use the audit report to determine what types of technical assistance should be developed and what types of corrective action would be most helpful. Through the information gathered from the audits, OCR will develop tools and guidance to assist the industry in compliance self-evaluation and in preventing breaches. So we've gone through the audit process for a desk audit, but we also want to make sure you have an understanding of the timelines associated with an audit. OCR will have notified covered entities on July 11th if they were selected for an audit. OCR expects covered entities that are subject of an audit to submit requested information via that secure portal within 10 business days of the date on the information request. All documents are to be in digital form and submitted electronically via that portal. Or if it's an on-site audit, it will be conducted over 3 to 5 business days on site, depending on the size. So after this on-site audit or these documents are received, the auditor will review the information submitted and provide the auditee with draft findings. Auditees will have 10 business days to review and return written comments, if any, to the auditor. The auditor will complete a final audit report for each entity within 30 business days after the auditee's response. OCR will share a copy of the final report with the audited entity. So from start to finish, we're looking at around 2 to 3 months, depending on how long it takes for the auditor to review the information requested initially. So what causes a HIPAA audit? We know there are random audits. However, other factors can increase your chances of being selected for one as well. An entity can be reported to OCR for not being HIPAA compliant. You don't have to be a patient or an employee to report a covered entity. Anyone can call. There are also what's called a whistleblower, where the person who reported it actually gets a percentage of the money collected. But no matter how it is reported, HHS is required by law to investigate all HIPAA violation complaints. So while anyone can rat you out to the OCR, there are some cases where the covered entity actually essentially tells on itself. How? Well, all breaches must be reported to the OCR. Depending on how many individuals are affected will determine when it needs to be reported and if the media needs to be notified. But regardless, each breach should be reported. And the idea is that if you are a HIPAA compliant, a breach would likely not happen. So this is a major red flag to OCR of a possible non-compliance issue that they may want to investigate. Business associates now that business associates can be audited, if they're found to be non-compliant with HIPAA standards, the next place they will look is to the covered entities it's associated with. And then finally, if an entity fails a meaningful use audit. CMS has the ability to report failed meaningful use audits to OCR. Keeping in mind that the primary reason to fail a meaningful use audit is a lack of a comprehensive security risk analysis, which is also required under HIPAA, why wouldn't they follow up with these entities to ensure compliance as well? On the subject of the security risk analysis, it is important to note, just because your security risk analysis passed for meaningful use does not mean you are HIPAA compliant. However, if your security risk analysis is HIPAA compliant, then it will pass for meaningful use. Basically, what I'm trying to point out here is that the HIPAA security risk analysis criteria is more stringent than meaningful use criteria. Continuing to take a look at possible causes of a HIPAA audit, we can look at the wall of shame. So the OCR has an entire wall of shame that lists health data breaches affecting 500 or more individuals. This is a result of the breach notification rule, which states 500 or more individuals affected by a breach must go on the wall due to obligation to notify HHS immediately. Whereas if less than 500 individuals are affected, they just need to be reported for the whole year by a specific deadline. So many people fear that if an entity has a breach, they are automatically out of compliance with HIPAA. However, regulators will try and assess whether a covered entity was out of compliance with the law, and that's what caused the data breach, or whether the facility was in compliance and an incident occurred anyway. Now, if we look at business associates, according to the compliancy group, 59% of business associates reported a data breach in the last 2 years that resulted in loss or theft of PHI. We know a business associate is a person or entity that performs functions or activities on behalf of a covered entity that involves access by the BA to protected health information. We also know BAs are directly liable under the HIPAA rules, which means they can also be audited. And if one of your business associates is not HIPAA compliant or fails an audit, the chances of OCR selecting you for an audit increases significantly. There are so many different things that can cause a HIPAA audit and require a CE to go through the entire process we just went over. But what happens if a CE is selected and receives their final audit report and are told they have failed? What are the ramifications of failing? Well, should an audit report indicate a serious compliance issue, OCR may initiate a compliance review to further investigate. Other ramifications of failing besides the compliance review are large fines and penalties, even possible criminal penalties, and increased chances for future audits as well. Let's look at some real-world consequences of failing a HIPAA audit. So Catholic Healthcare Services in Philadelphia, or CHCS, agreed to pay $650,000 as a part of its settlement following a mobile device theft that exposed patient PHI. CHCS provided management and information technology services as a BA to 6 skilled nursing facilities. OCR found that from the compliance date of HIPAA security rule to the present, CHCS had not conducted an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of ePHI held by CHCS. The BA also did not implement appropriate security measures sufficient to reduce the risks and vulnerabilities to a reasonable and appropriate level to comply with the HIPAA security rule. Unfortunately, this is not the first OCR HIPAA settlement this year that involved the BA, and it likely will not be the last. OCR Director Jocelyn Samuels explained in a statement that BAs need to implement necessary protections to keep any ePHI they may create, receive, maintain, or transmit from covered entities secure. She went on to specifically say, this includes an enterprise-wide risk analysis and corresponding risk management plan, cornerstones of the HIPAA security rule. Auditors often find businesses lack adequate security reviews, remediation plans, and employee training programs when they are evaluated. These deficiencies can cause significant costs from both the fines and legal penalties associated with a breach, as well as the time, effort, and money involved in the remediation of these mistakes. So the settlements that have occurred this far should be strong examples for healthcare organizations and provide lessons in what may need to be done to improve HIPAA compliance in your own organization and keeping patient data secure. So moving on to the new audit protocol, I'm going to go ahead and turn it over to Cindy Kincaid for the remainder of the presentation. So Cindy, take it away whenever you're ready.
Okay. Well, thank you, Lindsay. I'm sure that everyone is just either scared or bored to death right now, as this is some pretty heavy and really fun-loving material, but we're going to try to get through it for the rest of this and talk about the protocol aspects of the audit. So there is a new audit protocol, as we discussed, and it's the Department of Health and Human Services Office for Civil Rights released an updated audit protocol that it plans to use while investigating healthcare entities for HIPAA compliance. This is what we've been talking about, and this is the kind of thing that will be and the biggest change to the audit protocol is the distinction that OCR has made between what's required of business associates versus what's required of covered entities. The guidance is extensive and covers each type of audit along with precisely what action needs to be taken and by whom. So if we talk about the audit protocol itself, basically what we're going to do, OCR establish a comprehensive audit protocol that contains the requirements to be assessed through these audits. This audit protocol covers the privacy rule requirements for notice of privacy practices for PHI, the rights to request privacy protection for PHI, access of individuals to PHI, administrative requirements, uses and disclosures, amendments of PHI, and accounting of any disclosures. The protocol also covers social security rule requirements for administrative, physical, and technical safeguards. As you can see, the coverage is broad. Now, if you take a look at the protocol, we'll kind of take you through the framework. First of all, if you have the time and the interest to read this, you can see that if it's printed out, the protocol is 350 plus pages long. It consists of column headers that are labeled audit type, section, key activity, established performance criteria, the audit inquiry, and whether it's required or addressable. And we'll talk a little bit about that when we get to some examples. And there are primarily 4 types of entries for the audit inquiry: questions, inquire of management, obtain and review, and then evaluate. So if we take a look at these column headers, you can see that the audit type indicates whether it's privacy or security, the section of the document, the key activity, in this case, is prohibited uses and disclosures, use and disclosure of genetic information for underwriting purposes. We're not going to focus a lot on that, but this will just give you an idea of how granular this gets. The established performance criteria, the audit inquiry, and then whether it's required or addressable. And as you go through this, you will basically be able to identify whether this is required or addressable. So for example, if we look at the established performance criteria of the activity of disclosure of genetic information for underwriting purposes, It basically defines it as the use and disclosure of genetic information for underwriting purposes. I won't go through all of this, but as you can see, again, very, very specific. And then the audit inquiry is, does the health plan use or disclose for underwriting purposes genetic information? And if so, have all the proper steps and procedures been put in place to guide the disclosure of that information? So these are the types of things that go through this entire document. So if we move forward to the next areas, you can see that there are also general instructions. So where the document says entity, it means both covered entities and business associates unless it identifies one or the other. So if you're just seeing the word entity, it means both of these types of business associates and then your own entity. Management refers to the appropriate privacy, security, and breach notification, official or person that's designated by the covered entity or business associate for the implementation of policies and procedures and other standards. For example, do you have these individuals in place? Is someone identified in your organization? Entities must provide only the specified documents, not compendiums of all the entity policies and procedures. The auditor will not search for relevant documentation that may be contained with such complications. So in other words, again, you must be prepared to have the documents that they are requesting and not just hand them over your policies and procedures. And unless otherwise specified, all documents requests are for versions in use as of the date of the audit notification and document request. So you have to have the documents that are in use and available at the time you are notified. Continuing on, unless otherwise specified, selected entities should submit documents via OCR Secure Online Web Portal in PDF, Microsoft Word, or MS Excel formats. Those are the acceptable methods to be able to distribute this back. If the requested number of documentations of implementation is not available, the entity must provide instances from equivalent previous time periods to complete the sample. If no documentation is available, the entity must provide a statement to that effect. Workforce members include entity employees, on-site contractors, students, and volunteers, and information systems include hardware, software, information, data, applications, communications, and people. In other words, just about everyone and everything in your business environment. If we take a look at audit type, we'll give you a privacy example. So again, this one is privacy. You'll see again the section of the law, disclosures by workforce members who are a victim of a crime. So this is the event. So then it covers disclosures by workforce members who are victims of a crime. A covered entity is not considered to have violated the requirements of this subpart if a member of its workforce who is a victim, etc., etc. And then how can you determine whether you have succeeded? How has the covered entity ensured that disclosures by the workforce member related to his or her status as a victim of a crime are consistent with the rule? So once again, there's a whole catalog of rules and theories that you have to have in your policy. And again, just another example, this is a workstation, and so implement physical safeguards for all workstations that access electronic protected health information to restrict access to authorized users. Does the entity have policies and procedures that document how workstations are physically restricted to limit access only to authorized personnel? A lot of people don't even think about that. Do you have any methods in place to keep, individuals from coming up to workstations, behind workstations, unauthorized individuals into specific areas? Continuing on, does the entity workstations that access electronic protected health information restricted to authorized users? To obtain and review policies and procedures related to workstation security, evaluate the content in relation to the specified criteria for security measures and guidance on how to implement and maintain physical security, etc., etc. It's, again, very broad space and ultimately affects every aspect of your job. Audit type, this is a breach. So once again, breach, it's training. You must train all workforce members, must receive training pertaining to the breach notification rule. Training, and then again, to obtain and review the covered entity's policies and procedures, evaluate whether they are consistent with the requirement to provide training pertaining to the breach notification rule. Do you have a training program in place in your practice? It doesn't matter how small or large you are. I know at ITENIV we have to take HIPAA training every year. All of our employees have to do it, and it is something that we monitor very, very closely. You would expect that out of an organization such as ITENIV, but not everyone has these methods in place, and it is a requirement, and it is something that if you don't have, you need to be looking at how you have done it. So you can say then, has the covered entity trained its workforce on the applicable provisions? Obtain and review content of covered entities' training materials. They're going to see what you're training. Obtain and review evidence that all workforce members receive the training. An example, training sign-in sheets, certificates. In our case, we take the test and we obtain a certificate. It's filed in our system. Just one example of how the training might work. So let's talk about the elements of an effective compliance program, because in order to achieve all of these things, we just touched on the surface of this 350+ pages, but as you can see by the samples we provided, it's going to be a big challenge to make sure that everything is in place and that you have yourself covered. So if we move forward to a compliance program, we feel there's 7 elements of a compliance program, and we've looked into a lot of different areas, and this came directly from the Health and Human Services. Has an effective compliance program has 7 elements. First of all, implementing written policies, procedures, and standards of conduct, designating a compliance officer and compliance committee, conducting effective training and education, developing effective lines of communication, conducting internal monitoring and auditing, enforcing standards through well-publicized disciplinary guidelines, and responding promptly to detected offenses and undertaking corrective action. Compliance means having policies and procedures in place that directly coordinate to the regulations and demonstrate the results of your security risk analysis, while at the same time being able to prove with a paper trail or other forms of evidence that your workforce follows these policies and procedures. If you just look at the 7 items we just mentioned and then what the definition of compliance is as it relates to the HIPAA security rules, you will see that I know many of the groups we work with do not have this in place. Everyone is trying to get it done. You may all be where you need to be. You may be partially there. Again, it's something you really need to take a strong look at because the audits are coming. Whether it's this go-round, whether it's the next go-round, they are taking this very, very seriously, and we'll point out some other areas with or without an audit as to why this is important a little bit later. So how do you prepare? First of all, know the rules. Complete your annual security risk assessment. Make sure that it is comprehensive per HIPAA regulations. In the past, there's been the meaningful use of security assessment, and then there's the HIPAA audit or the HIPAA security assessment. Those were different. They weren't, meaningful use was not nearly as comprehensive as HIPAA. That's coming together. With MACRA, it's coming together, and there's not going to be a distinction anymore. So you really need to make sure that it's comprehensive per HIPAA regulations. Document your action plans with reasonable target completion dates for deficiencies covered in your assessment. You get some flexibility if you have a remediation plan in effect as you're working through this because you are taking plans to accommodate. Have a complete inventory of your business associates with their current contact information and up-to-date BAA on file. Do you have a business associate agreement with everyone that you should have a business associate agreement with? I know we're getting asked more and more to have them, but there are many times we've worked with groups that we've had to reach out and say, we need to sign your BA agreement. So make sure you have that with everyone, even no matter how small, anyone that has access to this data. Implement a breach notification policy per the breach notification standards. Have you even thought about a breach? Do you know what to do if there is a breach? Have a compliant notice of privacy practices. Review your HIPAA-related policies and procedures and perform any items that are past due. So several key questions you should ask. Does my business have written policies and protocols in place to address HIPAA standards? If you don't, you need to take steps to get one. Is my business performing and documenting regular risk assessments? I'm going to guess that many of you probably aren't as much as you should be. Does my business have an established data security policy? Does my business have a BYOD security and use policy? Are the business associates affiliated with my organization HIPAA compliant? Many people didn't understand that not only do you have to be HIPAA compliant, you have to make sure your business associates are and make sure your agreements are in place to that effect. Does my business have an effective incident response plan to handle a breach if it occurs? Do you even consider what's going to happen if it does? And are my employees required to complete regular HIPAA training programs? Do you have a HIPAA training program in place today? Because if you don't, you really need one. What we learned from the 2015 audit. So the audits have taken place. Lindsay went through a lot of the things, some of the real world activities. But what we have learned is small facilities are not exempt from OCR oversight. Many times groups think if they're small, they don't have to have these programs in place, but they do. There is no exemption from this. Timely detection and response time is essential. No risk analysis can lead to data security oversight. So if you don't have it in place, you're probably going to have a breach. And some of the breaches may not be even something that you would consider a breach, but anytime PHI is accessible or someone can get to it when they shouldn't, it's a breach. Basic adherence to privacy security rules is key. Reviewing policies and performing regular updates is necessary to maintain compliance. You can't just have it once and then think that's going to last forever. You have to be constantly on this. Just as I said, when we take our training every year, even though it's the same thing and we all may feel it's silly, it is something that has to be done, and you have to be able to demonstrate that you've done these things. So you have to review and continue to update ongoing. When we were talking about this, we've used the word mandatory a lot, and I always like to do this, so I always kind of go out to Wikipedia and ask, what's the definition of mandatory? In this case, it's an adjective. It's obligatory, required or commanded by an authority. It's of, being, or relating to a mandate. And synonyms are compulsory and obligatory. In other words, there's no choice. You have to do this. And as I mentioned earlier about the meaningful use and security and HIPAA and how they were, maybe different in the past. They are no longer, because MACRA is coming. Whether it gets extended or not, it is going to be here. And if you look at MACRA, MACRA indicates that it's a mandatory part. The HIPAA is a mandatory part. So even if you aren't audited, MACRA states we would require the MIPS-eligible clinician to meet the requirement to protect patient health information, complete an SRA, created or maintained by certified EHR technology to earn any score within the advancing care information performance category. Failure to do so would result in a base score of 0, a performance score of 0, and an advancing care information performance category score of 0, which means no bonus pools and, in the end, penalties. So let's talk a little bit about next steps. First of all, you can visit us at itentive.com. We have a lot of webinars and blogs, and you can always sign up for more of our webinars and our blog. And we would like you to also, if you haven't done this already and you feel that you would need some assessment, we certainly are one of the companies that are offering these types of things. So we'd like you to consider our 3 security risk analysis options, because depending on where you're at in your process, you may only need a little bit of help. So let's talk about self-assessment, remote security risk analysis, and on-site security risk analysis. Itentive is partnered with HIPAA One in order to achieve a HIPAA risk analysis program. So we can assist you in performing a thorough and accurate HIPAA security risk analysis. We will manage your HIPAA security risk analysis and guide you step by step through the entire process. So we can help you do your self-assessments as well as work with some of the on-site work that might have to be done. The methodology leverages the proven and tested HIPAA One software platform, which includes a comprehensive set of compliance questions, and it acts as a repository for maintaining the interview responses, supporting documentation, and the remediation action plan, which you will need if any deficiencies are found. So how we will help you is we can review your interview responses and supporting materials, assist with identification of areas where additional information is needed and clarification is needed. We can work with you to identify threats and vulnerabilities, as well as analyze controls in place. And we can guide the development of your remediation plan by prioritizing risk by the likelihood and the impact. So you can't fix everything at once, so we can kind of help you say, okay, this is more important than that, and get you on a plan that would help you pass these audits. We can help you track and document your ongoing remediation efforts throughout the year. And we would then be available as a resource to answer your HIPAA and meaningful use compliance-related questions. As all of the information that we went through and we've provided here, what we have tried to demonstrate is that there's a lot of different areas, and you may be partially in place, you may be nowhere near feeling comfortable that you're in place, or you may be somewhere in between. And we can work with you on different levels and different ways to help you move forward. So with that, I think we'll turn it over to questions. Lindsay is on, I'm on, Kathy Thompson is here, and we also have Chris Flores, not mentioned in the webinar, if we have any specific questions about the compliance tools.
Great, thank you so much. Thank you, Cindy and Lindsay. Thank you both for putting this together, and Kathy, thanks for being on to help with questions. Again, you can type any of your questions in the questions area of the webinar control panel, and we're just going to get to them in the order they were received. We don't have that many of them, so if you have questions, now's a great time to ask them. I know this was a whole lot of information, so I'm sure that many of you are just sitting there kind of digesting it all. So first question, are we notified through email, mail, or both?
I can grab that one. It is just through email. They're not doing mail, they're not calling anyone, nothing. That's why it's so crucial that you go through, because they have been notified, a lot of the emails are going to different clients' spam folders or junk mail, that you go through and unblock, or however you do it in your system, unblock that OCR email address for audits. Because the worst thing that could happen to you is you're selected for an audit and you had no idea you even got the notification email. So it is only through email.
Thanks, Cincy. Getting a number of questions about the slides. We're going to be sending out copies of the slides as well as a link to the recording of the webinar in a couple of days here, so keep your eye out for an email from me. Sometimes those do go into people's spam boxes as well, so if you don't see them in a couple of days, check there, or feel free to reach out to any of the people you see up on the list as well, and all of us would be happy to get those for you as soon as we get them uploaded. Let's see, next question. Will the auditors look at our state-specific privacy and security rules in addition to HIPAA's? Lindsay, do you want to answer that?
Yeah, I can grab that one. So good answer, no. The scope of the audit program really doesn't extend beyond just the privacy, security, and breach notification rules we kept hitting on today. Auditors will primarily just be looking at those specific parts of HIPAA. So for the audit's purpose, you don't need to worry about specific state rules. Again, don't throw them out the window completely because it's still the law. You still need to be compliant with them. But for these Phase 2 audits, no, they're just looking at those 3 aspects of HIPAA.
Thanks, Lindsay. Okay, a number of similar questions here. How do they know who to email, and how can we check who they're emailing?
The best point for that is it's who would ever be registered on the HHS website as your point of contact. So they would have emailed out to the first point of contact. They use publicly available information as well. You most likely would have received an address verification email a few months ago in the spring. But I would go through, you can actually reach out to HHS and contact them and ask them what contact information they have on file for you as well if you'd like to be safe and sorry. But I would go for that if you've ever, how you submit information or how you attest. I don't know, Kathy, if you have anything to add to this.
No, I agree. And the first thing I would do is, if you're not sure if you've been contacted, is go out to the HHS website. If you need any assistance on finding that information, contact either Lindsay or I after this webinar, and we can help you with that.
Okay, great. Thanks, ladies. Next question. If you received an email for the address verification, will you automatically receive the questionnaire? We did receive the address verification email, but did not receive the questionnaire. We have checked our spam files daily.
No, you shouldn't automatically receive it. If you looked in the address verification email, if there was no link to the pre-screening questionnaire, then you should be fine. If you check your spam, you should be good. That's going to be the primary way they are contacting you, the only way they are contacting you.
Thanks, Cincy. Next question. Cindy, maybe you can field this one. Do you help companies with meaningful use? What's the cost?
We do help companies with meaningful use quite a bit. We have a number of different programs and a number of different levels that we can assist you with. I'd be happy to talk to you about your needs, and then that will really directly relate to the cost. It can be really, really low, just as a quick consult, or it could be something if you want us to actually help you attest and go, start to finish. Again, it just varies. So we will definitely work with you on what you need and make sure that it's just exactly what you need. We work with a lot of companies on that.
Thanks, Cindy.
Feel free to reach out to me. Feel free to reach out to me directly. I think we have your email address. I think it's Nisha.
Yep, we do.
Okay, great. Well, we'll make sure we contact you as well.
Okay. If we have not received notification by email currently, should we continue looking over a period of time?
I can grab that one. You would have gotten the email on July 11th. They sent all 167 notification emails out. This is going to be that first round of the Phase 2 audits. Business associate audits will commence actually in the fall. So those will go through. But I think they're going to be doing another round of desk audits possibly later on this year or starting next year. So as of right now, in the immediate future, I don't think you need to keep patrolling. As long as you've taken, again, that HHS email and marked it as secure or trusted in your system, you should get everything and go through.
Okay, thanks, Lindsay. And it looks like at the moment this is our last question, but we'll hang on a few minutes in case anybody's in the middle of typing as well. What if we missed the address verification email and never responded? Lindsay?
Yeah, I can grab that one. So a lot of people were kind of convinced that this meant that they were left out of the audit pool. So as nice as that would be, I don't think anyone would have responded to that address verification email then. OCR actually did come out on their website and address this and stated that if an entity doesn't respond to the request for information from OCR, so that address verification, that initial email, they're just going to use publicly available information about the entity to create its audit pool. So basically to clarify, if you didn't respond, OCR still can choose you for an audit.
Okay, great. Well, thank you, ladies, for presenting, Lindsay, Kathy, and Cindy. Really appreciate it. And thank you, everybody, for attending. I know it took a chunk of time out of your day. I hope that you found it useful. Keep your eye out for an email regarding the slides and a follow-up to the with a link to the recording, as well as next week's webinar as well. Feel free to reach out to us with any questions at any time. We really are here to help, and there are no stupid questions. So just let us know what's on your mind.
All right, thank you, everybody, very much. And join us next week. If you think we're here, you'll really have fun next week.
Thanks, everyone.
Talk to you later. Bye-bye.